Today we are going to discuss about post-operative bed. I am Golden, working as tutor in M College of Nursing. Objective: at the end of the class, we will be able to see about what is post-operative bed, what are the purposes of post-operative bed, what are the additional articles which are needed for post-operative bed, and the procedure for post-operative bed, and points to remember. So definition: it is the best for the patient who is recovering from the effects of anesthesia following the surgery. Purposes: to receive the patient conveniently, to prevent the patient from shock, to meet any emergency, to provide warmth and comfort to the patient, to prevent soiling of the bed, and to prevent injury to the patient. Additional articles required for post-operative bed. A tray containing the following articles for post-operative bed are a small Macintosh and a towel to spread in the head end of the patient, IV stand and IV tray, suction apparatus, TPR tray, that is temperature, pulse and respiration tray, BP apparatus, oxygen cylinder with tubing, bed blocks. So what are the pre-procedural steps in post-operative bed are: prepare the bed as often in open bed. An extra Macintosh and towel are placed at the head end of the patient. The foot end of the top linen is left untucked and it is folded back evenly under the mattress. And fan fold the top linen along with the blanket and the counter sheet lengthwise in 2/3 of the bed. Place hot water bag under the top linen. Okay, so post-operative bed. In post-operative bed, we must prepare the bed as of open bed. Now spread the top sheet. No need to tuck the top sheet in the foot end. Just spread it over the mattress above the draw sheet. And now place the blanket above the top sheet. So why you are placing the blanket is to prevent shivering for the post-op patients. So spread the blanket. First to the foot end you must spread the blanket and then only to the head end. So after spreading to the head end, no need to tuck the sides of the blanket. Just spread it. Okay, now take the counter sheet, place it above the blanket, spread it to the foot end, and next spread to the head end. So after spreading to the head end, take the counter sheet, blanket along with the top sheet and make a half fold. Then come to the foot end, take the counter sheet, blanket and the top sheet and fold it in the triangular fold. So after making a triangular fold from the foot end, again from the half folded, we must make a triangular fold. So now make a triangular fold in the half folded sheet. And then again make a triangular from the edge and fold it in the manner. Now come to the other side and tuck all the top sheet, blanket and the counter sheet on the sides. And tuck it. Now come to the working side Place the hot water bag beneath the triangular folded sheet. Now place the Macintosh in the head end, and after placing the Macintosh, place a towel above the Macintosh and tuck it on the sides. On the working side, tuck the sides of the towel, and after completing on the working side, move on to the other side and tuck the other side of the towel. This is the post-op. Points to be remembered are, so why we are using blanket is to prevent the patient from shivering, because immediately post-operative patients may have shivering. So to prevent from shivering, we are using the blanket, and the reason for using the counter sheet are to prevent the irritation of the skin due to the blanket spread, and pillows are not used at the head end. Instead, Macintosh spread with the towel is used, and pillows are kept near the head end. Hot water bags are placed below the triangular folded sheet in order to warm the bed before receiving the patient. So as soon as the patient when we are receiving, we must remove the hot water bag. Thank you.